Hi, good morning, everybody. It's 11 a.m. PST. It is still the morning for us over here in the West Coast. It's actually a nice day. Went out for a little bit of a jog and trying to recover from 2 long COVID semesters. I think each of us know what that means. I'm excited to be with you today. Good to see you, Elaine. Good to see you again. What I wanted to do, we actually have a special guest today. Dr. Susan Shore has joined us, and she's the author of the Cardiopulmonary app. So we get to hear from a person who's used the app in the classroom and who has vision for why we built what we built. And I'm excited also to share with you some of the new apps that are coming our way, coming your way as well. So I thought what we could try to do is I'm going to have James man the chat. So if chats come in, please feel free to either chat in or to just unmute yourself and stop me. This is really, these deep dives are really for you to ask questions and to hear a little bit about, learn a little bit more about the apps in their depth, and for us to be able to help you figure out how to use it in your classroom to enhance student learning. And beyond enhancing student learning, which I know each of us bend over backwards to try to help students do that better, sometimes I think selfishly, how do I maintain my sanity? And how do we help faculty actually help them not have to reinvent the wheel? So I'm going to go ahead and share screen just so that everybody knows we're recording this for faculty who haven't been able to join us. So I'm going to go over here and start right over here. So I want you to know that today's deep dive is really about cardiopulmonary rehab and acute care as well. I'm going to add in towards the end some of the acute care apps that all of this kind of ties together, I think, and can make your acute care modules that much more cohesive, and really can enhance the students' ability to pre-expose themselves to content that they may have never experienced in their life. So I'm going to go ahead and move forward. Just as a quick glimpse of who I am. So I'm an associate professor at Azusa Pacific University. Susan and I have been colleagues since the beginning. For me, Susan's been there longer than I have. I serve as a teaching and learning fellow. I spent a lot of time learning and from experts of teaching at the university. I also completed my Kaiser Orthopedic Residency and Manual Therapy Fellowship and continue to teach for them, and also teach for the USC Spine Fellowship. We use our apps to bring the clinical practice guidelines into fellowship level education. PhysioU is my baby. It's something that I've dreamed of doing from the very day I stepped on as faculty at Azusa Pacific. And slowly over the years, it has grown to cover many, many other areas besides just orthopedics, which is my primary area of expertise. Lastly, I chair the institutional review board at our university. That's just a little glimpse of the story of my life. It's been a busy year for sure. And I would say this COVID last 2 semesters has really invited me to think carefully about the holes that are in traditional curriculums that we all faced, and the way that digital tools like this can help fill those holes or even take teaching and learning to a higher level. I'm pleased to say 1 out of our 72 students had a challenging time. The rest of them are pretty darn good. Some of our residency mentors, these are our grads who have come back, they teach in fellowships and residencies, said, man, a lot of our APU students are better than the first-year residents. So it's something to be said, I think. Kudos to all instructors who really tried their best to get their students through. I think we can do it. I think we're adaptable. And I hope these tools can help you also to raise the level for your students and to hopefully make your life a little bit easier. I was just on a call yesterday and the day before with the JOSPT team. We're excited. PhysioU is partnered with JOSPT. We are bringing videos to journal articles. We are bringing videos to case studies. Have you ever read case studies and said, man, I wish I could see what they did? Well, very soon, you'll be able to see What were the techniques in the studies? What were the techniques in the case studies? PhysioU is going to support that at JOSPT. So we're excited to be a part of that. And related to cardiopulmonary, PhysioU is excited to partner with Dr. Ellen Hillegass, so the PT cardiopulmonary educators. So she sent me a little quote here. As president and CEO of PT Cardiopulmonary Educators, I'm thrilled to be partnering with PhysioU and Dr. Michael Wong to provide the best resources for teaching cardiopulmonary education, including labs and case studies virtually. So I think this is very timely. I know Ellen's been doing a lot of great work with her textbook and her course, online course availability to help support educators. She noted when the institution where I'm an instructor, Mercer in Atlanta, Mercer University, went virtually for education due to COVID-19, we turned to PhysioU for labs and case studies to help our students who could not have hands-on lab. So this content is also great for new instructors who are not familiar with providing lab opportunities in an academic institution. So, you know, it's great to be able to support programs, many programs in the United States, and also to have the support from Dr. Hillegass. And I'm pleased to have Dr. Susan Shore with us. So Susan, I was just going to take a minute here and ask you a couple questions, because I'm sure faculty are very interested in trying to understand what's in the app. And I will share screen as you direct me, things you might want me to show, but I'm going to stop share for a second and just ask Susan. Susan, could you share with us a little bit about how long you've been teaching cardiopulm?
Yes, I've been teaching cardiopulm for about 20 years, I think. And before that, that was my practice area before I became an educator.
Great. And so over those 20 years, and I think much like any educator, we learn about the holes that make learning challenging. So it's not just about being a clinical expert, but teaching and learning is a whole different beast. Could you share with us a little bit about what were some of the challenges that you were facing that led to the development of this app?
Yeah, I think one of the main challenges in education, PT education, is students are not familiar with acute patients. If they've done some observation hours before they get into our programs, they're mostly in outpatient areas. They might have come across some chronic conditions, some chronic pulmonary conditions, but truly what an acute care patient looks like, it's a foreign animal to them. And so that was the challenge, to try to explain to them, try to bring patients into the classroom. You can't really bring an acute patient into the classroom. They're in the hospital. And so trying to help them understand what these patients truly are like was the challenge. And so the app, I think, has really helped us there, able to just get some sense of what these patients look like, act like, present like, and the issues associated with them.
Yeah, that's perfect. Yeah, I mean, you know, in ortho, the class that I teach, trying to bring in all the different types of common problems that they're going to see is difficult, if not impossible. And giving them a scaffold, a picture of the patient, their associated impairments, and matching those associated impairments to relevant interventions is really the trick, right? Connecting all the dots. So I'm curious, I'm sure the rest of the faculty are curious, how did you use the app in the classroom?
Yeah, so I also recorded, I had some recordings of anatomy, physiology, pathophysiology for each of the cardiac and pulmonary dysfunction areas. So typically the students would watch ahead of time and review anatomy, physiology, pathophysiology of conditions. So they, in theory, would come into classroom with that knowledge in their head. And we would start there. So based on what you have seen about the pathophysiology, how would you expect these patients to present? what would you expect them to look like, to their chief complaint to be? What would you expect? And so then we would pull one up. Yeah, pick one. Sure, restrictive is fine. We pull that up. Clinical findings. Well, let's see. Let's see what that patient complained of.
All the time, and I just have a hard time breathing. My doctor says it's IPF, whatever that is. It's some kind of a reaction, I think. I cough sometimes, but nothing comes up. It's just this happy cough. And I grew up on a farm. I don't understand what this is all about. But I'm going to have to go on oxygen soon. I just know it.
So then, based on that, so a patient, and they should have hopefully reviewed and remember some of what were the risk factors for this kind of disease associated with that. And so we could pull these up. What are the risk factors? Oh, what about this patient? What was, did she relate to that? What, she grew up on a farm. She's around coal farm, dust and so forth. So risk factors, and then what did you see about how she presented, right? What she complained of, and is that what you would expect? What else would you expect? And so just talking that through based on the pathophysiology first, and then going from there, what impairments did you see and what impairments would you expect? And then let's just see how we're going to assess these things. So what objective tests can we do? Would you do for this patient? And so several of them are listed here. Always going to listen to the lungs, always going to listen to the heart, and see how the chest wall moves and so forth. So various ways to assess. Being good PTs, we're always going to look at range of motion and strength. We're always going to think about aerobic capacity and the various ways that we can assess. Yeah, just click on one of them. So things to be aware of in terms of signs and symptoms for safety, right? And these are for both cardiac and pulmonary patients. How far are you going to let blood pressure go? What about oxygen saturation and so forth? So basically, from there, impairments, chief impairments, and then what are we going to do about that? What are we going to do about the dyspnea? What are we going to do about this chest wall that doesn't move? How are we going to work on chest expansion? Maybe just click on that one, Mike. Chest wall expansion. For these patients, right, we need to get air into the chest wall. We're going to do that by some of the breathing exercises combined with upper extremity exercises. The purpose of which is to address this impairment of decreased chest wall mobility.
Yep. So, I mean, very similarly, we did this exact same thing. I actually went to Susan several years ago and said, Susan, we have built this for ortho. Every single common condition, we have built a pattern that ties in the prevalence, ties in the patient's clinical findings, the common examination findings, as well as interventions and therapeutic exercises. Would cardiopulm benefit from such a pattern recognition? And Susan's like, hey, that would be perfect. We have these main patterns. Many of them, the objective exam is the same. And yet with some of the conditions, the objective exam is very different. There are certain things in this objective exam that is particular to congestive heart failure. And so we thought that being able to help the students see the differences, see how the interventions are different, would really then help the students to connect a lot of dots that we find are often not well connected when we just deliver techniques and tests piecemeal, everything disconnected.
I think, Michael, this is James, Dr. James. You know, one, I think you've had it easy, Mike, because a lot of kids get into PT school because I sprained an ankle, I had an ACL injury or something like that. Very few people come into PT school saying, well, I could just a heart failure, or I had a heart attack. So they don't know. So Susan, you're at a disadvantage that they don't know what these people look like, walk like, and talk like. So it's good they have the video to kind of show them, here's what these folks look like. And I love the way you walk through how you just don't give them like information like a dictionary, look the word up. You tell them how to make a sentence. I mean, you show, here's what you do, then you go through, and I think that's consistent with all of the PhysioU apps. So it's great to see that the Cardiopulmonary and the Acute Care thing is doing the same thing, where you're not just, it's not a repository of information, but you're showing the students how to think and problem solve and work through a clinical kind of pathway. So it's excellent. I really think that's just such a cool thing that the teachers, that the educators can use and to augment what they're already doing.
Yeah, absolutely. And you can see here too, we tried in the orthopedic app as well as in the cardiopulmonary app, what are the common outcome measures that are relevant for this condition? Wherever possible, we would hyperlink these directly to something available on the web to make it easy for you to access, right? And there's also here under the examination, if you look under the examination, there is a sample subjective exam interview that students can watch and learn to mimic. We also broke that same, it's generic, but it's the common questions that every student would be expected to ask. So they can basically watch and use this as a reference when they're doing their subjective exam. So Susan, I'm curious also, what was how did this help with your labs?
You know, students learn in different ways, right? So there are some students who learn visually. Most PT students are kinesthetic learners, but just to have read about something and then walk into a lab doesn't always work for them in terms of learning. It's not the best learning. They learn better by watching someone perform it and then coming into the lab setting, at least familiar, having seen it once, right? I perform it again, we do it together. But the more you see, the repetitive, it's a repetitive reminder of what that looked like. So I think it's important to be able to see ahead of time and then to practice. Then you can always, I don't know if other people experience this, but sometimes as a professor in the middle of a lab session, you can't think of everything. And you forget certain things they're really important to tell. So if we watch it, then I can say, see how her hands are, see how the patient responded. Do you see where she's holding the Doppler? Do you see, for example, and then perform it without having to worry about everything that I forgot to highlight ahead of time.
I could attest to this with a lab like shoulder lab in ortho and the gazillions of special tests. It is such a relief to be able to log in. All the students are in their pods watching the screen anyway, and I can show a number of different tests just using the app, which they have already previewed before even coming to lab. And then I can piggyback off of a lot of these tests. So there are certain ones where I absolutely will perform and demonstrate. There's many that I'll actually reference the app, and the students are just as pleased to say that, wow, I can see that almost better than trying to crowd around and watch the professor, which was typically what happened in our labs. Everybody would crowd around, 15 of them would get a good view and the rest would get a pretty crummy view. So having these videos available in your lab handouts is infinitely helpful, because you can always reference it and the students have a chance to preview a lot of the techniques. So Susan, I remember you would use this quick access panel here. This was essentially your lab handout. Mm-hmm. And you would pick out techniques that students were to watch or that you would watch together, and then they would take their computers and their iPads and go practice
Mhm.
because they had these already at their disposal, all of these techniques.
Yeah.
Is that right?
Yeah, that's right. And, students love the fact that they could always go back to these and easily reference them. Even if they didn't see perfectly during class time, they always had them.
Yeah.
Takes away the anxiety, right? It's
That's
always there. I can always look.
Right. So anecdotally, what did you find when you started using the apps? How did it help with your teaching? How did it help with student learning?
Yeah, I think in terms of student learning, as you mentioned, there are many, many techniques for examination. There are many techniques for intervention, and students have trouble figuring out what technique goes with what diagnosis. And so those became clearer, more easily defined. And as a professor, it was easy for me already to have in my mind how those flowed together, and I could easily just refer back to them. So in this pattern, this is what you would expect for a patient with interstitial lung disease, right? And we remember together, so.
Right. Yeah, exactly. And I would add in just one more before I open it up for some questions for Susan. The other thing that I think is unique here. So if we chose a condition, which you had mentioned earlier, so let's go to here, restrictive lung disease, under clinical findings. Actually, no, we watched that. Actually, under the physical exam, you have a little key findings video, as well as a simulated chart review. What are the things you tend to look at when you're in the hospital going through your chart review? Okay, so there's a video there for you as faculty to explore and for the students to explore as well. And here's a little key findings. It's kind of like these clinical pearls. So let's watch that.
Restrictive disease associated with interstitial pulmonary fibrosis and spinal cord injury. When you examine the patient, you will observe an increased respiratory rate with shallow breaths, decreased oxygen saturation levels, diminished breath sounds with fine inspiratory crackles, decreased inspiratory muscle strength, decreased aerobic capacity, and low generalized strength. If your patient has restrictive dysfunction not associated with pulmonary disease, such as a patient with a spinal cord injury, on auscultation, you will hear diminished breath sounds, but no accompanying crackles.
So you can see in this particular case that there's this quick summary, and we've done that the same way. As we all know, in today's generation of learners, micro-learning, giving them small bits to help tie pieces together are really so very critical. Okay, let me actually open it up for a minute.
There's a great question, Mike, that's on the chat. Catherine asked, and Susan, probably mostly for you, are they assigned certain scenarios of videos to watch before lab? Do they have like a pre-lab homework, or how do you kind of wait till lab first, or how's that go? And Catherine, if there's more clarification of the question, please take opportunity to unmute yourself and add more to your question if you need to.
Yeah. Oh, sorry. Go ahead, Susan.
No, you first.
We've toyed with the idea of pre-lab stuff and, the hopes that they would do that. A lot of them don't. So I was just curious, what do you have them do ahead of time? How do you hold them accountable? Do you, or is it just kind of, you hope that they do? I'd love for you to elaborate on that.
Right. Yeah, I'm familiar with that issue. They're busy people in our programs. Mike, do you want to show the handout that, like the lab handout for a particular pathology?
Yeah. And I can speak to this as well, because we did a lot of pre things for our ortho class, because there's so many techniques and so many conditions. And I can share about that as well, how we implemented it, as well as how successful it was. I will share that as well. Let me go to our PhysioU page to show you some of the resources that we built for you to help implement this. So under Educator, Faculty Resources, under Teaching Content, Susan, do you want to look at the lab or the clinical pattern recognition worksheets?
Well, the lab handout, oh, no, sorry. Let's go back to the clinical pattern one first, sorry.
Okay. No problem. So we'll go to the cardiopulmonary pattern. So
Yeah,
we
so
could use
pick
any
one.
one of these. Let's go with restrictive again, or we can do peripheral arterial.
So this they could have beforehand, Catherine, and to review for themselves and have something to write down and review gives a little more guidance to review these things ahead of time.
Right.
What type of function? Go ahead, Mike. You want?
Oh, yeah. I was just going to say, we built every single common orthopedic condition has a sheet just like this. It's a clinical pattern. And so what we did was we turned this into a walking tour of the app. And the students were told this week for ortho, you watch frozen shoulder, you go through the frozen shoulder worksheet, the shoulder impingement worksheet, and the unstable shoulder worksheet. So for in Susan's case, in this worksheet, this would be linked into your LMS. So the students knew for that week, I need to go through this worksheet. So when they go through and learn about peripheral arterial disease, and this is usually timed with your pathophys lecture, they will go in and click on the links. So they can watch the patient talking about his problem, what he was experiencing. Then they could go down and you would ask the question, what do you notice about the patient's presentation, his key signs and symptoms? How does this relate to the pathophysiology? What type of function do you suspect they will have trouble with? What are some common outcome measures that might be relevant for this particular patient? You could continue to walk through this whole thing, which ties into the physical exam. Let's watch the key findings video. So here's the key findings video for this particular condition. And what are the common objective tests that you're going to learn in lab? And what are the common interventions for this condition? And so on their own, I think of it as graded exposure. They knew that by walking themselves through this pattern, that when they got to class, now I remember, Susan, you had mentioned when they came to class, you would walk them through the pattern again, and then you would add in all of your little clinical pearls and tie all these loose pieces together. But the beauty of it is, because since we developed apps from the ground up, we knew that there was enough information in here to become overwhelming for the students. They wouldn't wander in and start exploring on their own. But if you created a worksheet that walked them through the different pieces, it reduced their fear of exploring. And when you tied it to the synchronous online or synchronous face-to-face connection, right? When you're talking about these conditions, then actually it unlocked the value of the app for them. So this was actually from our own past experiences of saying the apps in and of themselves have so much information that when unguided, it can be overwhelming. But when guided and targeted, can actually be a part of your graded exposure. And we use these worksheets in ortho, in cardiopulm, as ways to create scaffolds. Susan, did you want to mention anything on top of that?
No, I think that's right. Anything that can be a little bit more structured is helpful. Leading their thinking, and this helps them, in their thinking process. So,
yeah.
There's another question, Mike and Susan, and that is, are there any handouts? This is from Evan. And are there any psychomotor skill checklists or checkouts?
Yeah.
This now dives in pretty deep to the class. I mean, what are your motor skill requirements with lab and stuff? And do you have any kind of from the Cardiopulm and other apps for the PhysioU suite of apps?
Yep. And then before I move on to those lab handouts, the other thing I was going to say about how successful were we in getting the students to do these worksheets. Eventually, what the students found was that when they did the worksheets, they actually felt much less overwhelmed when we were going over things in class together. Now, in ortho, I used the apps to talk through the patterns pretty much every week. It's almost easier in cardiopulm because for an entire cardiopulm class, you've got 4 or 5 main conditions. In ortho, every week I've got 10, which is even more overwhelming. So the students knew that there was a structure to the way that this course would run. And I have that really tied into the presentation here that I'll show in a second. And that is the students knew that they were going to do their worksheet for the week, which is linked in their LMS. Then they have access to their lab handout. Their job, and what you can see here in the lab handouts, is we have created a number of generic lab handouts. The classes that we think are fairly predictable, we created lab handouts for you. So here's your physical exam techniques. There is a Word version that you can take and edit for yourself, or there's a PDF version that essentially has all the physical exam techniques, all with images and hyperlinks. So if you scroll down to here, you just click on that. It takes the student directly to the video for them to preview. So in ortho, every student went through their lab handout on their own. And I told them ahead of time why we were doing this, because lab can be very overwhelming and there's lots of techniques. So when you pre-expose yourself to them and explore where they are in the app, the ability to learn and understand things is much deeper when they finally get to class. This is from a number of different professors that have used it in the same way. They said when the students came to class, it was remarkable how quickly they understood what the technique was for, how to practice, how to do the technique, because there was this order, this multiple exposure type of process. So that was the lab handout. That helps to answer the lab handout. And I think in order to make students really do things, you have to show value. And that value is inherent because they can tell how muddled their mind is when they come to class unprepared, as compared to when they try to do the worksheet, when I talk them through the patterns when we're in class, they can really see that their brain is much less muddled because they've spent time exposing themselves to this different content at different phases over multiple time periods. I think sometimes the challenge of these clinical classes are that we have so much that we need to teach that everything gets dumped on the table all at once, when in fact, the way students should learn is really over a deep soak. It's you don't water them over, you don't spray 10 gallons, right, of water on them. You trickle micro gallons to them over a longer period of time, and it should be strategic and dependable. I think that's another thing that the students really valued this year, was when we created this system, they found that it was dependable and it really worked. I don't know if that helps. Other comments?
Just the psychomotor checklist thing.
Yeah, the psychomotor checklist, what I had just shown was we had created these generic worksheets for you as faculty to use in your classroom. So you have, all of these lab handouts here, and you can edit them and modify them as you so choose. So you have physical exam, you also have interventions. These are the patterns. And, for another app that I was going to show you later, for all of your transfers, gait patterns, bed mobility, we have worksheets. We have lab handouts for all of it. So you do not need to actually create these. These are the same things that everybody's teaching. And we've created lab handouts for all of it. Other comments, James?
There's a question, and I just typed in the chat. I'm going to be typing that to defer to the end. That's how do students get it? What's it cost? Stuff like that. But we'll defer that till the end, right?
Yeah, it's
Okay.
a subscription. The students pay for an annual subscription to all the apps in the suite. The stuff that we've created covers probably 50% or more, probably closer to 70% of a PT school's curriculum. But I can cover that in the end.
Is that okay, Ann? Can we wait till then? And Ashley, if not, we can, you just
Yeah.
put in the chat that you want to know now.
Let me show you. Actually, we've covered a lot of this, which is great. A few different ways to use this app in your classroom. One was scaffolding for deep learning. And that was really to use these cardiopulmonary worksheets, right, that I'd mentioned. When they walk themselves through the app, they become familiar with this resource as a learning tool. The second thing I would say is it is very valuable for you as the instructor. Every class, I pull the app out because as the instructor, you have to become familiar with the learning resource. And the more you use it, the more they use it. It's just like a textbook. If I never use the textbook, they never touch the textbook. I use this app every class in some form to show video techniques, to show them how things are connected. That is one big thing I would say to any faculty who's learning to use these apps. Don't be afraid to pull it up. You just log in. You're already logged on Zoom. You log in and you have it ready. You can. The more you leverage it, the more the students begin to value it and begin to use it for their own learning. So those clinical pattern recognition worksheets, invaluable. Okay, we spent 2 semesters doing it for ortho. It created so much context for the students. The other thing, I think this might have been related to Evan's question, this idea of motor skills training. Wow, we were scared at the beginning of fall last year. We were like, how are we going to show these techniques well? How are we going to help them learn their motor skills? Well, we created a process. One, we hyperlinked all the techniques that we were going to teach into our lab handout. So the students knew at the beginning of the semester, I said, guys, we spent a lot of time to build videos into your lab handouts. The way you are going to learn best is, 1, before you come to lab that week, preview the techniques that you're going to learn. 2, try them on somebody, or at least do some mental imagery. Think about it. Try to mimic it in your mind. I mean, that's what athletes do. Well, we are clinical athletes. And then when we got to class, I walk them through the apps. We look at select techniques. We practice these techniques together. Now, remember, this is exposure. Exposure 1 actually happened when they did their clinical pattern recognition worksheet. Exposure 2, they went and previewed their lab handout. Then they tried things out. Then we met for lab. And lastly, we did virtual checkoffs. Now, virtual checkoffs were okay. I think it's always better face-to-face. We are now back to face-to-face. But the students signed up for a time with a TA and were asked to do techniques on a checkoff list that I had created. But the checkoff list was not just, please perform McMurray's test. It was more like patient comes in, has locking and clicking of their knee. They were in a cutting injury during soccer. What is a special test you could do? So the checkoffs became a stepping stone towards the clinical reasoning, and that actually turned out to be quite useful. So we did virtual checkoffs every week for the techniques that they were expected to learn. Here is this concept of augmenting your lab handouts. This is just a mock-up that I put together, but you can see our ortho lab handout looks a lot like this. There's a URL, and the way that you get to these URLs, there's 2 ways to do it. Let me just show you real quick. If you are in the web page here, so let me move this off to the side. If you are here in faculty resources, so educator, faculty resources, there is a master video cheat sheet. So here is all 3,000 techniques from ortho. Here is cardiopulm down here, all of your techniques organized and all the hyperlinks that you can just copy and put into your lectures or lab handouts. So you have a lot of different ways, and you can do a Control F, incentive, spirometer, and there it is. So you could just search through the spreadsheet. Here's neuro, here's range of motion, MMT. All of these are all here for you. So you can see faculty here using the spreadsheet to augment their lab handouts. The other way that you can do it is you can go straight into the app itself. So if I go back into the app and I choose a technique, physical exam technique, objective test, peripheral circulation assessment, ankle brachial index, I can grab this URL and copy and paste it. So you have a few different ways. The students, when they click on that link, will be asked to log in because they have their own subscription. Once they are logged in, they can just click away. And as you can see, the techniques will just come up. So that's one of the ways that you can augment your lab handout. Here's another lab handout. So you can basically cut and paste links into your lab handout. So let me move on here. You also notice the clinical pattern recognition worksheets. I have found this to be invaluable. I think this can be useful for your students as well. It's homework, but it's actually cool because it's linked to an app. So instead of having them dig around in a textbook, they're actually watching videos that help them, right? That help them to discover the patient. So again, these can be hyperlinked. You can basically grab the link. You can grab the link, copy the link, and drop that right into your LMS. The students just know during this week, I need to work on this worksheet, and I'm going to learn about this patient's problem. Okay, so that's that. That's the clinical pattern recognition worksheet. So the call to action is what I had mentioned earlier. I tell them at the beginning of their program, at the beginning of 2 semesters of ortho, that there is a method to becoming a clinician. It is going to take some work on their part. And part of that is every week they're going to do their clinical pattern recognition scavenger hunt. Now that'll be different for cardiopulm, or it may be similar. We had so many patterns, they had to do it every week. So they would use these worksheets and be exposed to these patterns, because when they met with me face to face, I was going to talk through the pattern again. They still need to know that I'm the expert and I'm going to help them see how all of this comes together, but they don't come to me as a blank slate. They come to me with a lot of things already pre-populated. I just weave all of this together better with my stories and my clinical experience. And then the interactive case study. So I want, Susan and I put some work into these. I want to take a moment to show it to you. Okay. So
Mike, can I interrupt you just for 1 second as you're kind of transitioning? Real quick, one of our participants needs to leave, take care of family issue, family first. And real quick, that subscription kind of stuff, a 1 minute quick one on that.
For your students, it's the simplest way to do it is, guys, this is what we're going to be using. Come June 31st, we are changing this back to our normal rate, which is not the COVID rate. So it will be back to $90 a year. And remember that this is not just an app for cardiopulm. It covers almost every class in PT school. So just so it's less than $10 a month. But this is how they would do it. Or if a university is planning to buy it for their students, then they can always touch base with us and we can figure out what, it's essentially $90 a year. But if they purchase it before June 1st, you have this COVID rate. I hope that helps, James.
Yeah, and you'll talk later maybe that, the business side of this thing. I mean, they're really willing to work with bookstores and however, the best acquisition thing. Kids can put on their account, their scholarship money can be, however it works.
Right. They can use their financial aid if we work with your bookstore. So there's a lot of different ways to do it. They can just reach out to us at care@physiou.com and we can take care of any of their purchasing requests. So let me just show you, we're getting close to the end here. I want to show you the case studies. So here, we knew that anytime you're teaching a clinical class, there's value in talking about a case, right? So here is your case study. These are meant to be, you should be able to break your students out into Zoom breakout rooms, have them watch the video of the patient, and read the basic history, what their occupation is, what their history of present illness, right? A lot of their chief complaint, past medical history, some basic aggravating and easing factors. And we purposely put these here because some of the cases are actually multiple systems cases, right? Your patient with peripheral vascular disease who's having pain with walking also happens to have a really stiff back and may also have spinal stenosis. We purposely made the case in some of these cases a little bit more, forcing the students to think, right, more broadly. So here's your basic chart review. Now, we get to the questions. What findings are consistent with a diagnosis of CHF? Now, all of these answers for now are all here, but we ask them, go into your breakout rooms, answer these together, and then we are going to come out and discuss it. These reference answers were primarily here. So here, the findings consistent with CHF. It is linked to the clinical findings portion of the app. The patient is referred for PT. What findings would you expect from the physical exam? We've put these answers here to facilitate the instructor's ability to help with the discussion. Okay, we don't ask the students not to look at these. In the future, what we might do is when a faculty member logs in, the answers are here. When the students log in, there are no answers. They're just questions for discussion. Now, there's other things here. For example, you decide to auscultate their lungs and hear the following adventitious sounds. What is it and why might it be present? So there's things like that. Or, for example, you note during exercise, the rhythm has changed. What is your interpretation and what is the appropriate thing to do? So all of these cases are now available for you to facilitate clinical reasoning and discussion, all built into one place. Most of our apps have that, right? So that's the case study portion. I think our dream here was not only would this help faculty teach motor skills, develop clinical patterns, but that there would be case studies here available for you to discuss and facilitate clinical reasoning. Comments and questions before I move on from the cardiopulmonary apps to just the remaining acute care apps and a new app that I want to show you.
Just Evan, if you are satisfied with the response regarding the psychomotor stuff, and then there's Julie will address your question about the rate at the end.
Okay.
So Evan, if you want to unmute or if we got thumbs up. Okay, thanks, Evan.
Great. So I want to show you a couple of other apps that we've designed for lines and tubes for acute care. So for lines and tubes, actually, I'm going to show you 3 pictures here: assisted devices and pharmacology. So let me give you a quick glimpse here. I'm going to go to lines and tubes. This is a quick reference guide. Okay. Here are the common lines and tubes that students are going to be exposed to. Here is what they are for, the placement, the indication, and what are some of the clinical implications. We have connected this to some clinical education worksheets. Okay, so what I mean by that is if I go back to here, educator, faculty resources. Oh, actually, it's under clinical education. There are some lines and tubes worksheets. So as the DCE can chat with a clinical instructor and ask the students, hey, every week, I want you to submit one worksheet for your most complicated patient. I want you to name the lines, tubes, and drains. What is the purpose for those lines and tubes? And what are the implications? They would link directly into the app to fill that out. And then they have a discussion every week with their clinical instructor. Okay, so that is the lines and tubes reference app. Let me find where we were here. Yep, here. All of our lines and tubes are here, basic lines and tubes. There is also some basic case studies so that we can discuss the common lines and tubes. And there are some questions and some basic answers, again, to facilitate discussion for you. Okay, so that's lines and tubes. I want to show you also, because assistive devices is part of our kind of our acute care series, all of your assistive device fitting, all the different types of assistive devices, all of your gait patterns. So let's talk about modified 3-point gait. Why do you use it? What device are you going to use it on? And we filmed it for both right and left lower extremity. The reason we did this is because the students will use this to learn, but they will also use this to educate the patient, which means when they're finally in the clinic, they can share this page with their patient, and the patient can now watch this video for free because it's part of extending the care. So they learn, the student learns in the classroom with this video, but you have both right and left lower extremity. You can see we marked the leg with a red stocking. And all of this actually goes to stairs. I want to use axillary crutches with right extremity, non-weight bearing. And here is how we do it: ascending and descending stairs. All of these videos we use to teach in the classroom, and then they use these when they're in the clinic by sharing these videos. So this app includes bed mobility. Okay, it also includes sit to stand, stand to sit with different assistive devices. These are all videos, of course, with instructions. It's just students hate to read about this kind of stuff. That's why we filmed it all.
Mike, while you're doing this, the question, you dropped the word free and it woke people up.
Yes.
How is the how the student watched for free?
No. The patient, meaning when you say, hey, this is how you're going to move, let's say it's patient caregiver education, and this is the video that you use to teach.
The following is how you would perform a stand pivot transfer. You will first begin by having the wheelchair as close to the strong leg as possible. And then you're going to have your patient scoot towards the edge of the mat and then lean forward as they stand up on a strong leg. And then you'll have them pivot towards the chair, assisting them as necessary. Reach back for the handle, lean forward as you slowly lower yourself down into the chair.
So what I mean by that is so in the classroom, that's how the students learn and they practice with this video. But when you're in the clinic and you need to show a caregiver how they're going to do that, you just share the page and email that to mswong@apu.edu, and an email will go out to me, and they will be able to watch this link. Now the link expires after, it looks like a week, but this becomes a clinical tool as well, is what I'm trying to say.
So they email that to the patient?
They email that to the patient.
Yeah, and that's there, Catherine. That's where the free days,
Yeah,
here's what we're
free.
yeah.
Yeah.
Patient education. Yep.
I would say though that all faculty have access to our PhysioU apps. I mean, I'm a faculty member. I know how hard we work. So all faculty members have full access to these apps to teach with, regardless of whether you're going to have your students purchase it or not. So I love the idea that we are creating tools that make faculty's lives easier. But it sure does help for us to continue to film and build new things for students to subscribe to things that are useful. So all faculty members have full access. So this is assistive devices. It includes wheelchair, purpose, factors to consider, fitting, mobility, pressure relief. These are all important videos that you can share, right? So that's assistive devices. And one of our newest apps that I thought would come in handy, for all areas. So for example, if you go to the pharmacology app, you have a lot of different ways to access the drugs. But if you think about Lasix, okay, so furosemide, here is furosemide. the common brand name, the category, common adverse reactions, right? Common serious reactions, as well as implications for rehabilitation. So for many of the most common drugs, myself, a number of different educators, along with a pharmacist, we went through and put together to our best ability implications for rehabilitation, not for all drugs, but for many of the common ones. Again, we have a ClinEd worksheet for that. So here is the ClinEd worksheet. If I go back to our app here, got too many tabs. You can understand why I have so many tabs. Here's ClinEd. We ask the students, hey, so when you're in the clinic, here's your pharmacology in practice. We want you to do a medication review on one patient, your more complicated patient. Every week, please fill this out. What medication is this patient on? What is the purpose? What are some precautions or side effects, right? Things that they could use the app so they could directly click to the app. And they may use other resources as well. But again, how do you make pharmacology real? You ask them to actually clinically reason through a patient once a week. So you can ask ClinEd instructors every week, please have our students fill this out on one patient and have a brief discussion with you. Again, ClinEd, the ClinEd faculty, so to speak, the CIs, they don't have time to teach all of this, but the students can go through, apply what they've learned, and discuss it with their clinical instructor. So that's also available as a way to take what you're learning in the classroom and really impact the clinical education experience. All right, so let me just finish off here by showing you what's coming. Here is a summary slide of how we've been using the apps in our classroom. Discover, the clinical pattern recognition worksheet for Cardiopulm. Preview, the lab handout. Play, meaning in class, I walk through the app with them every week. Practice, because you have all of this exposure. And then we are working really hard and filming a lot of things to help build simulations. I believe, because ortho can be such a crazy mess, that at the end of every week, the student should be able to play through a simulation that helps to pull this stuff together. So we've built almost 40 simulations for orthopedics. We have filmed simulations for acute care, which I'll show you next. So Dr. Jennifer Nash and I are working through and getting ready an acute care app. We have filmed all the common forms of bracing.
All right, so this is our Jewett hyperextension brace. Just to reorient you, the front is the part with the sternal or chest pad and pubic or pelvic pad. The back here has the thoracolumbar pad. On the sides, you're going to see two different enclosures. This strap is meant to take the whole strap off. You just pull it to release. And on this side, you have a box that you want to pull that'll give it a little bit of leeway to make it easier to put on. And then you want to tighten again to add that extra support once it is on. You do that just by pushing this open. Okay, so you want to have that all loosened before you try to put this on your patient. Again, you're going to put this on them when they're in bed, unless you have a doctor's order telling you you can do otherwise. You're going to have them wearing a nice shirt, a nice snug fitting shirt underneath, or the hospital gown. And you're going to want to make sure that there are no creases and that their full skin is covered by that gown. All right, so this is going to get placed right on top of the patient. You want to make sure it's nice and midline. The sternal pad is usually just below, maybe 2 finger breadths below the sternal notch. And then the pelvic pad is going to go across the hips. All right, so this is our...
So what you see here is donning and doffing of all the common braces. We filmed it, it's done. We also have videos of errors, common mistakes that students or clinicians make that we will turn into user activities that will help the students actually to learn from a different direction. From a case studies perspective, we have filmed full treatment sessions of a patient with CVA. This is a real patient, COPD, TBI, trauma, spinal surgery, total hip replacement. And we've broken those videos up into little segments, but this is the full video here that I'm just going to show you. So here she is coming in. She's chatting with the patient. She's cleaning her hands. She's going to check some vitals. And we have the entire treatment session broken up into things like entering the room, bed mobility, edge of bed, getting out from bed. The entire session we filmed, except that we're breaking them up into small segments so that we can create learning experiences out of them. One way we're going to deploy it is you're going to have these different videos, these different sections with questions that you can use to prompt discussion in the classroom. All of these videos will be available to you. The other way that we're going to do it is we're building these into interactive learning experiences where as they are watching these videos, questions will come up and prompt the students to identify the lines and tubes that the patient is on, that is connected to the patient. Identify some precautions that they may want to take as they get the patient out of bed. So there's a lot of cool things that we're going to be building out of this, just so you know that this is all filmed and already ready. We're just preparing a lot of the content. And the hope is that whether COVID is here or not, that we can enhance learning for the student and make your life easier as an instructor. Any comment? I'm very curious. Any comments and thoughts about what we're building here with the acute care content? This is pretty much the end of this presentation. I thought we'd leave just a couple minutes if we have any more time, just to have some comments from you as faculty. Oh, I will change that, Elaine, from CVA to stroke. Got it. Good point. Yes, we did bloopers, Evan. We're doing bloopers, exactly. The students, we filmed this whole thing about total hip replacement where we did everything possible wrong, you know, and then that's a perfect place for us to help students identify things. I mean, it's interactive learning.
Mike, have you thought about offering this to programs like DO? The reason I ask is because there are many students that are DOs on where I live, and some of them told me they said, we're really going to try to work on developing apps. And I was like, on like range of motion and those kind of things. And I said, well, those really already exist. And so I just wondered if that was an option.
It's on my list, but my first love is PT and the rehab sciences. And so all of the things that we're building will be PT, OT, speech, AT, and then everybody else, whenever we figure out to squeeze 27 hours out of a 24-hour day, I'm on it. But yes, I mean, I've been thinking about them as well.
And some of these are totally relevant for them as well. I mean, as I've looked through many of your offerings, they could really use them pretty much as is. So they asked me to ask you. So
yes, I mean, I would love to be connected. If you have a connection, I'd love to chat with them, what they need.
I'll get you that. Thanks.
Right. Other comments?
James, again, real quick, before one of our participants has to leave, she has to leave real soon, the cost thing, but also realize, I mean, with Dr. Wong and Susan and the group there, you know, you saw UNLV, there's been a lot of input from University of Idaho, right, Mike? And I mean, it's therapists helping therapists, educators. And so please, if you have any ideas and suggestions for what what gets added and what's worked for you, Daniel, what's worked by using it already, you know, please share those stories with Dr. Wong, because it just helps him know where to continue to move this forward.
Yeah, and once again, for those of you who are trying to figure out how to use this, first and foremost, make sure you get your version. I think everyone who's signed up for this webinar should already have access to these apps. If you don't, please email me or care@physiou.com. For purchasing, it could be just as simple as saying, guys, this is what we're going to be using. We're going to use it in 7 different classes, from GATE to acute care, to ortho, to neuro. I mean, some of the new apps that we're coming out with are groundbreaking. And that I haven't really shown you the simulations that we're building and the interactive evaluations. Just this last week, we filmed an interprofessional evaluation and treatment of a patient with a spinal cord injury or a traumatic brain injury. A physician, a nurse, a case manager, an OT, a PT, and a speech, all doing evaluations, treatments, and a team meeting. Those will all be built into an interactive asynchronous learning experience, because I think today the technology can drive the learning. We can do better. And so those are some of the things that we're working on. Any other last comments? I know you guys have stayed on over time. I'm really thankful for you for taking the time to learn a little bit about the apps. Are there any other comments for Susan, myself, James, or anybody else?
Share your email contact information. It's in the chat, but let's make sure we get it.
Yeah. You can always reach out to me. I'm happy to do a demo for your faculty. If anytime you're like, could you come in and share? Or so our faculty could ask you some questions. It's mike@physiou.com.
Yeah. So Julie, please reach out. Dr. Wong, you're so approachable and accommodating to folks to help move the education ball forward.
Yeah. And, just as a plug for what James is working on, we are creating an interactive experience for laws and regs for every state. So James's hands are a little bit full, but soon students will be able to learn about the laws and regulations through simulated, contextually rich games. And they're all tied to the laws and regulations of your state. So this is a big project that James is passionate about. I believe in it. I didn't like having to read a 50-page PDF about laws and regs. There should be scenarios that make the laws and regs relevant. And so James, we were done. We finished California. James, we finished Texas.
Yeah. Guys, I got my hands in so many different pots here in New Hampshire, Oregon, Missouri, Kansas. Been looking at that, talked to some people at Wichita State, and I just I got to just keep my head down and just keep going.
Yep.
50 different ways to do shoulder rehab. Because every jurisdiction is different. So
yep,
it's crazy.
Any other comments? Well, please, everybody, feel free to reach out to me. This recording will be posted. Actually, we'll be sending this recording out to all of you. So if you have colleagues who weren't able to attend or you think would find it valuable, you can share this with them. You will also be able to find this video on our website at the same faculty resources. So here, educator, faculty resources, under the deep dive webinar series. We will post this latest one here under the cardiopulmonary acute care courses. They'll be able to watch this. Thank you, everybody. I hope you have another great semester. And PhysioU is there to help you, enjoy your teaching, because I haven't worked a single day in my 17 or 18 years. I love this stuff. And you can see that this is what has spawned all of these different apps that are coming out or already out. So please feel free to reach out to me, and look forward to being in touch with all of you again. There are more webinars coming up. For those of you who are interested, again, you can look under faculty resources. There's more webinars, and I'll be talking about simulations coming up June 1st. I'll show you what we are building. Excited to share that. All right, everybody, take care. Have a great afternoon.